I want to just thank you so much for allowing our students to come and discuss all the different details regarding our acupuncture program. My name is David Coronado. I am the Assistant Manager of Admissions. I have the privilege of being with Dean Yu at the end, and of course our esteemed past graduates and current students of our DACM program. I would love for my colleagues and I will say honestly friends to please introduce themselves for our members here. If you can, starting with.
Sure. My name is Kenneth Middlestadt. I am one of the most recent graduates of the Doctorate of Acupuncture and Chinese Medicine program. I graduated in April, and that's that.
As valedictorian, by the way.
My name is Mason Martinez, and I'm a Term 6 DACM student, and I'll be graduating in December 2019.
My name is Elizabeth Robledo, and I also just recently graduated in April with Kenny.
Hi, I'm Monty Lebash. I'm an 8th term DACM student. I'll be graduating in April 2019.
Hi, I'm Jenny Yu. I am the Dean of the College of Eastern Medicine, housing the Doctor of Acupuncture and Chinese Medicine program.
So with all that said, I just really am curious for our past graduates and of course our current students, what about SCU attracted you the most, first and foremost?
Let's go first.
Popcorn.
Something that attracted me to SCU was not only just the beautiful campus that we have here, but also the integrative part. This is probably one of the most integrative acupuncture programs in the country, if not the most. We're educated along with chiropractors, physician assistants, and we really have a strong curriculum as far as the basic sciences go, and that's something that was really important for me. Correct me if I'm wrong, but we're the only acupuncture program in the country who has a cadaver lab. And that's something that's really important to me. If I'm going to be a healthcare practitioner, especially wearing the title doctor, I should know what the body looks like internally. And so that was something that really attracted me to this program.
Wonderful. Anyone else?
Yeah, I'm an out-of-state student, so to make the move out here to California, the reasons were kind of similar. When I was doing my research, the integrative nature, that was one of the first things that was advertised on the website. And in fact, when I visited the campus for the very first time, fell in love with, we have this little area called the Glen outside that everybody kind of sits at. You can picnic out there during your lunch hours, and great opportunity to just be in Southern California and fully immerse yourself in the program.
So when I came to look at the campus, I, like my two friends right here, was also astonished by the greenery. I went to a lot of different acupuncture schools to see their campuses, and they were all in very small buildings, like on the 4th floor. And I personally can't really deal with that. I have to be around nature and, be able to breathe a little. So that was a really big factor. But something that also stood out from this school that the other schools didn't really do when I was doing my tour was that I was able to meet up with the dean. I was able to talk to the doctors that were in the clinic as well as students, and they were so friendly. They were very open about the program, about what the expectations were, about all those things. And I thought that it was really important, especially to communicate with people that were currently going through the program, not just an admissions, counselor who was just trying to promote, I thought that that was a really big part of me saying yes to accepting the invitation into SCU. Mm-hmm.
And yourself now?
Yeah, so I also love the beautiful outdoor campus. I remember visiting the campus for the first time with my mom and walking around and looking at the trees and sitting in the grass, and it was just such a welcoming and opening space. But I really fell in love with the curriculum. I remember looking online and pulling up all of the classes and reading through every single one and being so excited, not only for all of the Eastern and Oriental medicine classes, but also all of my science classes, like seeing that I was taking all of the anatomies and physiologies and things that I'm so passionate about, that really drew me to the program.
Mason, you mentioned the curriculum, and it's really, I will say, highly robust. It's probably one of the most robust programs because you are getting a huge amount of content that is beyond what most acupuncture programs, in my opinion. But it doesn't matter about my opinion. It actually matters about your opinion. And I actually wanted to ask you regarding the curriculum, what stuck out the most from your current classes, those that are in currently, and those who have graduated? What stuck out the most about the curriculum that you could share with our audience?
Yeah, I've got something. I would say as a recent graduate that, I'm currently going through some review courses for boards, and one of the most common complaints that comes up amongst the acupuncture profession, and I would say students as a whole, is feeling uncomfortable in the basic sciences and a lot of the anatomies and physiologies. And that's a huge strength of this program. Given the fact that we have a very integrative focus and we want to bring acupuncture out to the world to be seen more than just in our private offices, get out in the hospital systems even, having that foundation of Western knowledge with the Eastern knowledge as well. That's kind of our job as practitioners of Chinese medicine, is to be able to integrate those and bring those to the masses here in the United States. So.
I have to agree with Kenneth. Just the amount of basic science and clinical sciences as well that we're trained along with physician assistants. And one of the current students just delivered a baby, and I'm just like, wow, I have the same education as somebody who is in surgeries and is delivering babies. And that's something that really struck out to me.
Yeah, I've had two really big moments recently that let me know that I chose the right school. And one is a class that I'm in currently. It's a diagnosis class, and it's a class that we share with the chiropractic students. And it's mostly neuromusculoskeletal problems, and we're just case after case and coming up with a diagnosis, and I'm able to keep up with the pace of the other students in the class. I don't feel behind. I know the orthopedic exams, and I'm able to be fully involved in all of our group discussions. And then another huge moment was we recently, all of us went on a trip to China. And being in China, I was able to see the strength of my Eastern classes. And we were able to communicate with students and people in the hospitals there and see that the same thing that we're learning in our classes here in the States is what they're learning there in China currently. So those were both huge moments for me.
Yeah, I could very easily say that it's a program that is completely well-rounded. It's not too Western, it's not too Eastern. It is exactly what is needed in the medical field right now, especially since we're trying to integrate this to be out in, inpatient hospitals and all these places where there are MDs and DOs and physician assistants. And, as Mason was saying with the physical exams and the neuromuscular tests and all that stuff, these are classes that acupuncturists don't really focus on much in other acupuncture schools. So once they graduate, they have to take CEUs, and CEUs can be really expensive. And there isn't that, one-on-one with the professor when you're taking a CEU usually. And if there is, it's a very limited time. Right here we have labs, so you could come in during your lunch